going to do a quick little video on an overview of how to build a suction system. Okay, so I've worked with people that just take for granted that every room you go into is going to have a fully functional and appropriately set up suction system. And speaking from experience, I can attest that that is not always the case. And really, everybody, especially respiratory, working in critical care, emergency room settings, or even just in a general care area, if you're taking care of maybe a trach patient, needs to have the ability to really swiftly build a suction system and know all the necessary, pieces of equipment that you're going to have to be able to kind of figure out where they are and assemble them. Now, in real life, if we're working in a situation where there's an emergent situation, you need to be able to do this really, really quickly without batting an eye. At first, it takes you a little bit of practice, all right, but it's something that should really be committed to muscle memory, and you should be able to crank out at any given time as we kind of proceed forward. So just kind of point out a couple of things here. You can see wherever your head wall connections are, we already learned about medical air, medical oxygen. You can see there's going to be a vacuum source. So this is actually vacuum pressure that's piped in throughout the hospital. Now, you can see we have similar shapes, or different shape settings or sizes and things like that, different shape orientations that allow us not to be able to put the wrong thing in. Obviously, you wouldn't want to put a gas delivery source into a vacuum line and vice versa and things like that. So you can see you're going to have a suction regulator. So this pressure coming out of the hole in the wall is unchecked. I don't know how high it goes, very, very high. Just like with a flow meter, we need something that can kind of fine tune and specifically dial in exact amount of pressure we're trying to work with in this particular situation. You can see it's kind of that square shape. It's labeled vacuum. They come in a bunch of different sizes and designs, but all of them are pretty similar. We have a hookup that's going to go into the wall. We have an outlet down here that is going to be able to allow us to direct that vacuum pressure into a formal suction canister system. And then there's some sort of a knob that gives you the ability to switch in between different settings. So you can see off, regular, just usually means constant or continuous suction, and then intermittent means the vacuum regulator will crank out a little bit of vacuum and then turn off. So on and off, on and off. And as we progress through certain skills, we'll learn kind of what you need to do with each. And then there's a knob that allows us to turn up or down that amount of vacuum. So you're going to push it until it clicks. Now, if I turn this on right now, you can see I'm on regular. You probably don't see, let me see if I can kind of stabilize this, clear that image up a little bit, maybe. You might have trouble seeing the intricacies here, but you can see I don't have any suction on, even though I'm on the regular setting. Sometimes these get dialed down so much that you got to keep turning, and then you'll hear that vacuum set up, and you'll see that little pressure gauge start to rise. If I put my finger on there, you can see it goes sky high, show me the max amount of vacuum that I'm really pulling through. So if it doesn't automatically turn on, you can't hear it, and you're on the correct setting, make sure you adjust that suction regulator to provide more vacuum until you see it kind of moving. Now, I could hook up tubing right here and suction something out of a patient's tracheostomy tube or an ET tube, but I got problems. It's going to gunk this thing up. It's going to gunk up my wall, and it's going to be absolutely gross. Not saying you won't see people do that mistakenly, but there's got to be a better way. So I'm going to turn this off for a second here. What most rooms are going to have, or sometimes you got to track one of these down. A lot of times in critical care setting, we'll have these in every ICU, multiple ones in every single room. Some places you got to go track something down, but this is something that is actually reusable. So don't throw it away at the end. I think that's why we have trouble finding them. It's a hard plastic system. They come in a couple of different variations and things like that, but all pretty similar. And you can see it's got a bracket on the back here. It's got a little piece of tubing. It's got a little adapter right here. Now, there's usually going to be some sort of a bracket on the wall somewhere, on this, whether that's mounted permanently here or on the rails or some other sort of system. What you're going to want to do is get it relatively close. It doesn't have to be, especially depending on what length of tubing you're going to use to attach. This slides right down in through there. So after a room's cleaned, we might just have this sitting there, and all we got to do is put the disposable stuff back in. Okay, so once again, these are reusable. We sandy wipe them down between use. As you can see, there's nothing I could really attach, in order to provide vacuum to a patient with the way things are right now. So bring in this. This is suction tubing. So There is usually a shorter length of tubing to connect this regulator to the back of this system here and kind of pull stuff through. Now, what I will tell you is a lot of times we lose those and we're just using standard suction tubing. These come in different lengths. A lot of times if you see a really, really short line, that's going to be too short to go to a patient. Usually they're really, really short tubing, and sometimes we just wipe that down and don't replace it because it shouldn't get soiled. We go from this little outlet right here, and it's just going to hook up into the back of this piece right here. Okay. Now, same deal. I could hook suction tubing on right here once I turn this on, but that's going to foul this entire system. I said all this stuff is reusable here. So that brings us to the suction canister system. The part that we throw away or dispose of, it gives us this little flimsy plastic drop-in container. All it is, if it falls apart or something like that, you can see there's little clasps on here, and there's a little flange. This little piece just kind of drops in, seats like that. You're going to have a lid because just like with positive pressure, if we don't have a semi-sealed system, it's hard to get, build an appropriate gradient and get things to kind of move. So that little lid goes on. We're going to go ahead and drop this down and in. All right. Now, if I turn this on right now, I got vacuum right here. Now, some places have these, some places don't. This does make a constant noise. So if you go, man, I see the pressure on my regulators on. I just can't hear anything, and it's not a closed system, so you're going, what is going on? Sometimes there's this little on-off switch, okay? So just make sure you have those. Not everywhere's going to have those, but just realize that those do exist. So if you look on the top of this, and I'll show you one more time, there's a couple of little holes. Now, obviously, we want this thing to be sealed, right? If I have a big hole, I'm not going to be able to generate that vacuum and pull stuff out of a patient. You can see there's one that actually says vacuum, and it's a little bit of a bigger diameter, and all we're going to do is direct that here. Now, what happens is I got vacuum coming from the bottom of this, all right? It's going to go inside of this chamber, and then I got a little outlet I can attach stuff to, but now if I suck some goobers out of somebody or some oral secretions or anything like that, it's going to drop down into this system and not really taint my reusable parts, much less get all the way back here. I just need something to attach to the top of this chamber that allows me to suction things from a patient. So there's a couple of things here. A lot of times you'll have one of these little plastic kind of semi-transparent elbow adapters here. Ideally, we're putting that on. It gives this ability to have a little bit of visualization where any sort of bodily fluids are going into the chamber in case something gets blocked up and crusted or anything like that. Allows us to keep better tabs on it. Sometimes you lose these. We're going to take this length of suction tubing, all right, and usually that would just hook up right like this. And now I got suction to the distal tip here, but if you can't find that elbow, it is okay to do this, but it's just not preferable. I could have something that's kind of blocking that up, and I may not know as well. I might go, I feel like I got suction. So it's important. That's all this little clear piece is for. And you'll see some other systems, you'll have 2 or 3 ports where you can use the same canister for multiple different applications. A lot of times in an ICU, we might have 3 or 4 different suction systems running and everything like that, hooked up to various different things for various different purposes. So we got the little adapter here. That's great. Now, when it comes to setting pressure, we'll talk about context-specific pressure regulation. I want to look here, and you can see, you see a little needle pointed where my pressure is. Right now it's 160. For us to truly know what that max pressure is going to be, we want to see how much pressure it exerts if it reaches an occlusion. So it latches onto tissue or something like that. And that's how we adjust our pressures, okay? So I'm going to go ahead and with my thumb over that, you can see it cranks up big time. I would then dial this down to my preferable setting to be glove finger, ideally. And then I could go up or down with that occlusion. So you can see just because you got a good value here does not mean that's going to be what the pressure is once you're down and kind of doing your thing. So we do want to include that and ensure we got the ideal pressure and don't exceed any maximums that we'll talk about before going and getting too involved in a procedure. Now sometimes you have a difficult time, this is not a long length, you might have a lot of stuff going on in a room or somebody moving around. You can get multiple pieces of suction tubing, and some places make longer lengths. This I think is just a standard 6 foot or something like that. They have these little adapters that you can find, and this is called a Sims connector, and it just slides in right there. It's kind of like an O2 tubing adapter, and you can put another length of suction tubing on, all right? What I'll tell you is before I get ready to use suction, not only do I look here and confirm and make sure I got good pressure, even if I try and not believe or trust whoever I'm following and ensure that the system is still functioning. So it's my job not just to look and make sure everything is appropriate, but it's also important that before I go down and do a procedure, I can actually hear and physically feel that I got appropriate vacuum. And then at this point, we could attach suction. I'll teach you guys different devices for oral suction, tracheal suction, all these different things that we can attach here. But I want to make sure that I got good functional suction before I get too far along and ahead of myself. Let me show you what some people do wrong constantly when they mess this up. A lot of people can put this together, but they're not thinking, okay? And what they end up doing is something like this. They're trying to suck from the top here, all right? And you can see it automatically collapses my canister. And then they start trying to pull like this, okay? Now, while this works, I give you a unsatisfactory on this for a competency. What's going to happen is you're going to suck a bunch of stuff up through this reusable part, and it's going to be ruined, okay? So if you see your suction system collapsing like that, it's because you set it up wrong. We always need to be going down in through the bottom and pulling stuff through the top, so it drops straight into the reusable part there, okay? And that's a quick overview of how to build and kind of a little bit of an intro on how to adjust a suction collection system. So I hope that helps.